Edith Rodriguez lay on the tile of an emergency room waiting area in Los Angeles for 45 minutes, vomiting blood, while the staff who staffed that room walked past her as if she were part of the floor pattern. Other patients witnesses to a collapse called 911 because the people on duty were not helping. A janitor mopped around her. She died there on May 9th, 2007. She was 43 years old. Her death began with a treatable condition that went unrecognized in time. Edith was a resident of South Los Angeles. She arrived at Martin Luther King Jr./Drew Medical Center in the early hours, escorted by her boyfriend Jose Prado. Because abdominal pain had become unbearable, the hospital was the primary public facility for a densely populated, predominantly Black and Latino community, an institution meant to serve people who had few alternatives. The building bore a record of regulatory warnings and patient care failures that would, within months, make continued operation impossible. On arrival, she checked in and joined the waiting room population. The room was busy. It had nurses and aides moving through it. Edith could barely stand from the pain. Witnesses described a progression from discomfort to collapse. Surveillance cameras recorded the scene. She went from a chair to the floor. For 45 minutes, the footage shows staff walking by. Her condition visibly worsened. She vomited blood. She could not get up. Those minutes became decisive. The footage shows an emergency department functioning in name, but failing in response. Staff members moved purposefully through the area. None initiated resuscitative steps. A janitor mopped the floor near Edith's body. Patients called 911 to report a woman dying in an ER while staff did nothing. One caller told the dispatcher that staff had told the woman to get up. She could not. The visual and audio record converged into a single fact. The hospital did not act with the urgency the situation required. 911 callers inside the hospital prompted a police response. Los Angeles Police Department officers arrived and attempted to provide aid. Only after the police intervened did medical staff place Edith on a gurney and move her to treatment. By that time, her bowel had perforated. The perforation led to septic shock. Emergency medicine offers established treatments for a perforated bowel when patients are identified and treated promptly. Edith did not receive timely care. She died in the same building where she had sought help. Martin Luther King Jr. Medical Center's regulatory history contextualizes this failure. State and federal inspections had repeatedly cited inadequate patient care, failures in monitoring deteriorating patients, and systemic noncompliance with corrective plans. The emergency department had been the subject of prior citations. The deficiencies were documented long before May 9, 2007, and mapped to patterns of missed care. Those records are not abstract. They are the backdrop to a human life extinguished while waiting. The administrative and regulatory response escalated after Edith's death. County and state health authorities opened investigations. Federal Medicare and Medicaid officials signaled that continued funding would be in jeopardy if the institution could not meet basic standards. Los Angeles County concluded that the costs of bringing the hospital into sustained compliance were prohibitive. 3 months after Edith died, the hospital closed. The building later reopened as a restructured facility, but the closure marked the end of an institution that had repeatedly failed its community. Edith's case resonates beyond one building and one date because it fits into documented national patterns. Emergency department crowding, prolonged wait times, and failures to identify and treat patients who are deteriorating in waiting areas occur widely, most heavily in public hospitals serving low-income communities. Studies show disparities by race and income. Patients of color in public EDs often wait longer, have their pain reports discounted, and suffer worse outcomes from delays. Edith's experience is not a singular anomaly, but part of a pattern of unequal care. Her death became a public symbol. The image of a janitor mopping around a dying woman crystallized debates about triage, resource allocation, and accountability. The story forced questions about what a hospital should be and what it becomes when systems intended to protect life lapse into neglect. The answers are technical and administrative, but the human consequence is simple and stark. A person went in for help and did not receive it. Edith Rodriguez arrived seeking treatment and died waiting for it. The failure was clinical, organizational, and moral. The hospital's documented citations, the footage of staff passing by, the 911 calls from patients, and the subsequent closure together tell an investigative truth about how systemic neglect produces preventable death. She was 43. She should have been treated in time. Subscribe to Case Files TV, because a hospital that allows a patient to die on the waiting room floor has already stopped being a hospital.